Welcome to episode 129 of Real Health Radio. You can find the links talked about as part of this episode at the show notes, which is www.7, so the word all spelled out, seven-health.com/129. Before I jump into this episode, I have an ask for you guys. A couple of times a year, I take on clients, and client work is the core of my business and how I spend the vast majority of my time. And after working with clients for the last decade, I feel very confident in saying that I'm very good at what I do. And yes, I help clients with various symptoms, but it's actually much bigger than just removing symptoms. These are struggles that these individuals are obsessed with and defined by. Their problem has become how they identify and think about themselves. And my clients have often worked with multiple practitioners and are on the verge of giving up. It really isn't uncommon for me to be the fourth or the fifth or the sixth person they've come to. And where I see myself being different to others is by combining science and compassion. So I'm evidence-based in what I do and have a strong grounding in physiology and why the body is functioning how it is. But at the same time, I'm compassionate. I listen to the mental and emotional side of the client's experience and know how these aspects are of equal importance to health as the physical side is. And one of the aspects that I like most about the work that I do is how positive the process is. People believe that what they're going to go through is going to be giving up so much, that it will be painful in so many ways, but they'll then convince themselves that it's better for their long-term health. But what they find is that the changes actually add to their quality of life. They enjoy the changes and the new life it brings. Their physical, mental, and emotional health improves now, not at some distant, far-off time in the future. And after working together, my clients are able to regain what they thought was impossible. Having their period again, conceiving, feeling energized, purposeful, and alive, and walking by a mirror without the dread of seeing their own reflection. And I put so much free material out into the world. The podcast is free, the blog posts are free. And while the free material I put out, I really stand behind, it is much more general. You have to discern what is and isn't relevant for you. But when we are working together, I'm the one who can sort through this and show you what is important, what's the low-hanging fruit, and what are the levers that will make the most difference for you. So if you want this kind of precision in helping you recover your health, now is the chance to work with me. So if you're interested in finding out more, you can head over to www.7-health.com/help, so HELP. And there you can read about how I work with clients and apply for a free initial chat.
Welcome to Real Health Radio. Health advice that's more than just about how you look. And here's your host, Chris Sandel.
Hey guys, welcome back to another episode of Real Health Radio. This week, I'm doing another one of my solo shows, and normally these are a deep dive into a specific topic, and I suppose this one is kind of that too, but it is a little different. So I'm in the process of putting together a show about the complexity of health, looking at the multitude of factors that affect health status, and not just things like eating healthy food or doing exercise, but looking into detail about what would drive these kind of behaviors. So really delving into socioeconomic factors, what behaviors are modeled to someone as a child, genetics, and just lots more factors that really impact on this. And it's easy to make statements like good health is a choice. But what I want to cover as part of that episode is how that choice is very easy for some people and doesn't even feel like a choice because of the environment they've grown up in and the skills that they have. Versus for someone else, it would be going against everything they've ever seen and experienced. And with a lack of resources and support, it makes it much, much harder, if not almost impossible. So I was working on that podcast episode and putting together information when I received an email from someone working in the health field, talking about the fact that for the third year in a row, life expectancy has decreased. And this is for the US, and it's based on the CDC figures. And the email stated that the reason for this was because previously we were dying of infectious diseases, but now we are dying of chronic disease like diabetes and Alzheimer's, and that chronic diseases should be thought of as disease of lifestyle. And what was implied was that if people could switch to a healthier diet and a healthier lifestyle, then we could turn this around. So I decided to look into the figures about what was actually going on. Because like I'd been noticing with my podcast and I'm putting together on the complexity of health, even if diet and lifestyle habits were part of this, it seemed that this was only a half-truth, that there was more to it than just this. And what I found was that this would then make a really good standalone podcast. It's probably a little shorter than others, but I think it's a good demonstration of why simple answers and simple solutions that we often hear will barely scratch the surface. Because they aren't addressing the why. And they too often see it through the lens of what that individual would do or how they would think, not understanding what it's like to be a different person who's growing up in a totally different life experience and lives in a completely different environment to what they inhabit. So as part of this episode, I'm going to be looking at life expectancy for both the UK and the US. These are the two areas or the two countries that have seen the biggest dips in life expectancy over the last handful of years. So it makes the most sense to comment on both of them. But not just look into the UK as a whole or the US as a whole, but looking at different segments of the population and how, depending on age or where you live or socioeconomic status, life expectancy has actually been doing very different things. So before I jump into this, let me briefly explain how they work out life expectancy. And I say briefly because it's kind of a complicated formula. Life expectancy figures, unless otherwise specified, are based on life expectancy at birth. So, for example, if the 2017 figure is 79 years, this means that for all those people born in 2017, they are estimated to live 79 years. Now, the way that they work out this figure is actually by looking at the mortality figures for all ages. So they look at all the people that have died over a specified time, and then they break it down. So what was the mortality rate for a 1-year-old, a 2-year-old, a 3-year-old, etc.? And this is known as age-specific death rates. And from doing these calculations and looking at the age-specific death rates, they're able to then come up with the life expectancy figures. And what this also means is that they're able to separate out the data and look at the different sections of the population in isolation. So, for example, they may be able to see that for people who are already in their 40s and 50s, life expectancy is actually increasing. But for those in their 70s, life expectancy is decreasing, which is something I'm going to look into as part of this episode and how different sections break down. I also should say that the figures talking about life expectancy are typically based on a couple of years beforehand. It obviously takes time to compile all the deaths and then calculate what the life expectancy is. So, for example, there's been a lot of articles recently about the decreasing life expectancy in the UK and the US, but most of these articles are making reference to the 2016 figures, as this is the most recent year where all the numbers are being crunched on what life expectancy should be or is. In places, people make reference to changes in mortality figures in 2017 or increases or decreases in certain deaths for certain segments of the population for 2018. But in terms of actual life expectancy figures, these are all based on 2016 and earlier. And the figures that I have looked at are using the Office for National Statistics in the UK and then the Centers for Disease Control and Prevention, which is the CDC in the US. I think it will be around December time that the new life expectancy figures for 2017 will actually come out. So let me start by looking at the UK figures. It was really around 2011 that things started to change in the UK. So for decades, life expectancy had been increasing, but it was around 2011 that things started to slow down. So life expectancy at this point still continued to increase, but much, much slower. So for example, going back to the 1980s and onwards, life expectancy was increasing by about a couple of months every year. So in 1980, the life expectancy for a man in the UK was 70.6 years, and for women was 76.6 years. By 2011, this was up to 78.8 years for men and 82.7 for women. So over that 30-year span, there was an increase of roughly 5 years for life expectancy. But between 2011 and 2016, things have slowed right down, with the 2016 figures showing life expectancy for males at 79.2 and for females at 82.9. So that's a very meager increase in this time. So why is this occurring? This is a question we don't have a definitive answer to. And this is going to be the same when I look at the US figures. And with this, there isn't ever going to be just one answer. This is going to be an issue that is multifactorial. So let me go through some of the possible reasons that have been provided both by the Office of National Statistics and others writing on the topic. So the answer for the UK that comes up more than anything else is austerity measures by the government, which is really reduced public spending. So in 2008, there was a global financial crisis, which in the UK hit rather significantly. Then in 2010, there was a change in government, with the new approach for dealing with this problem being cutting spending to save money. And when there are spending cuts, those who are economically disadvantaged are typically hit the worst. And now I should just say that this isn't meant to be a political episode with me showing my political leanings. Rather, I'm just trying to understand or explain why life expectancy has become stagnant in the UK. And the biggest reason is economic inequality. And this becomes most apparent when you start to look at life expectancy changes, not in the UK as a whole, but break it down by regions. And this was true before 2011, with life expectancy increasing faster in areas of affluence versus more economically deprived areas. But the problem became much more stark when services that were offered started to disappear, which is then more acute in its effect on those who can't find and afford an alternative. So let me look at some of the figures for England and for Wales. So in 2012 to 2014, life expectancy for a newborn baby boy was highest in Kensington and Chelsea. It was at 83.3 years. And it was lowest in Blackpool of 74.7 years. For newborn baby girls, life expectancy was highest in Chiltern, which was 86.7 years, and lowest in Middlesbrough, which was 79.8 years. So we're talking about a difference of about 7 years between the wealthiest areas versus the poorest. And in the UK, a lot of this discrepancy is based on where you are in the map. The majority of local areas in the bottom 50 with the lowest life expectancy at birth are in the northeast, the northwest, and Wales. And the top 50 local areas with the highest life expectancy at birth were in the southeast, the east of England, southwest, London, and East Midlands only. So pretty much as you go further north, life expectancy gets worse. And this holds true when you then include Scotland, which then has the lowest life expectancy and the highest mortality rates of all the UK. Now, some of this could be to do with climate. As you go further north, there's less sunlight in the summertime, there's harsher weather in the wintertime. But we actually see these differences that are similar to this north-south divide, even in places that are right next to one another. So, for example, London as a whole has some of the highest life expectancy of anywhere in the UK. And between 1993 and 2014, this increased by 7 years. So it showed some of the highest increases in life expectancy of anywhere in the UK. But when we look at different areas in London, we see that it's not all the same. So there was a report done in 2010 called the Marmot Review that looked at inequality. And they looked at a hospital ward in Kensington and Chelsea, so one of the wealthiest parts of London, and found a man could expect to live to 88 years. They then went only a couple of kilometres down the road to Tottenham Green, one of the capital's poorer wards, and found that male life expectancy is 71 years. So that was a difference of 17 years, and this is back in 2010. So this is before all of these changes in life expectancy where it really started to dip off. And the report concluded that such health inequalities are avoidable and that they stem from inequalities in terms of income, education, employment, and neighborhood circumstances. And it's really inequality that is at the heart of all other potential reasons for the changes in life expectancy. So another reason that is proposed was that there was a particularly bad case of influenza in 2015, and there's actually been a number of bad flu seasons between 2011 and 2016. This year, 2018, the winter was one of the worst on record. We don't have life expectancy figures, obviously, for this year, but we do have death rates. And to quote the Office of National Statistics, more deaths occurred on almost every day in quarter one of 2018 compared with the 5-year average. In fact, most individual days saw more deaths than the corresponding day in any previous 5 years. This is probably due to a combination of influenza and several uncharacteristically cold spells during February and March. And when we have a harsh winter or we have a flu season, we see more hospitalization, and that then exacerbates demand when supply is pinched. And so those in the poorest areas are hit the most. We've now experienced one of the hottest summers on record, I think, since 1976. And I imagine that once the figures come out, that there could be a similar increase in death numbers because of this too. So changes in climate are another possible reason for the increased mortality rates. But again, this is made worse because other social services have been reduced. There's been an increase in the level of diabetes and Alzheimer's, which is linked to the slowing of life expectancy figures. And not just Alzheimer's, but mental health issues as a whole. But again, this disproportionately affects people along economic lines. And these kind of conditions, along with other chronic diseases, are often what people point to when they see these figures. That it's down to individual choices around what you eat, if you smoke, how much alcohol you drink, whether you exercise, and that this is what affects your health. But as the Marmot report mentioned, income, education, employment, and neighborhood circumstances all affect this. For example, when people are under stress, their focus changes from meeting short-term needs rather than long-term health. If you're in your 30s, you've recently lost your job, you're unsure when the next one will turn up, you're unsure how you're going to pay the rent, this changes your priorities. Thinking about eating more vegetables because it will better protect you from Alzheimer's when you're 70 just isn't what you're focusing on. Or that getting in regular exercise will mean that when you're in your 70s, you'll be able to play more with your grandkids. That's just not important. It also makes it more likely you're going to value things that give temporary pleasure, especially if this is passive pleasure. So more palatable food, alcohol, watching TV, staying up late, scrolling on social media. And this happens across the economic spectrum. Like chronic stress changes our priorities. It's just for those who are more economically deprived. There's more of this in their life, or more of their life that is spent in this state. And for those who are economically advantaged, even if they spend a similar time in a stress state, their access to better quality food, healthcare, living conditions, etc., mean that their life is longer, even if it's not as long as someone who's economically advantaged and is able to prioritize health more. Another possible explanation that was given is that the UK gave up smoking on average much quicker than other nations in Europe. So they saw an early bump in life expectancy, but the rest of Europe is now catching up, and this is part of the difference. This could be part of it, but I'm just not sure how much of a difference this is really making. So Australia gave up smoking in a fairly similar way to the UK, and its average smoking rates now are also fairly similar. And yet Australia's life expectancy has continued to rise over the period that the UK has stagnated. And again, smoking is something that happens more along class or economic lines. Scotland has the highest rates of smoking in tandem with the life expectancy rates. And if we look at specific areas, this trend also follows. So I mentioned earlier that Blackpool had the lowest life expectancy in Britain for boys between 2012 and 2014. Well, Blackpool in all surveys between 2012 and 2015 was in the top 10 heaviest smoking local areas. It was 8% higher than the UK average. I also mentioned that Chiltern had the highest life expectancy for girls for the 2012 to 2014 figures. Well, they are consistently in the bottom 10 local areas for smoking rates. And we can then see a similar picture if you look at alcohol consumption levels and death by alcohol consumption. It disproportionately affects people along economic lines. So that's life expectancy in the UK. It's not just as simple as the fact that too many people are eating unhealthy now or they don't exercise enough. This is part of it, but there are much bigger factors that are driving this. And what appears to have made the biggest difference in the UK since 2010 is the reduction in services and funding that most hit those who are less economically advantaged. So let's now look at the US, and actually its figures are much more worrying. If we go back to the mid-60s, the US had a higher life expectancy than the UK. It was marginal, but it was by about a year. By the mid-70s, things were pretty even, and the UK and the US started to track almost together. But it was then in the mid-1980s that things started to diverge, and from this point onwards, the UK and US life expectancy were still increasing, but the US were doing so at a lower rate. But by 2012, by 2012, the average life expectancy in the UK was 80.9, and for the US was 78.74. But while the UK then saw life expectancy figures slow but continue to increase, the US then stopped. So US figures for 2012, 2013, and 2014 were all the exact same. Then 2015 saw a decrease, so it went down by 0.0 of a year on 2014 figures. Then in 2016, it decreased again by 0.0 of a year. And now that they're estimating the same will happen for 2017 when the official figures finally come out. So as of 2016, life expectancy in the US is 78.6 years, with male life expectancy being 76.1 years and female being 81.8 years. But rather than just comparing the US to the UK, we see a similar picture when the US is compared to other countries. There's a collective known as the Organization for Economic Cooperation and Development, the OECD, and it's an organization of 36 countries and includes many countries from Europe as well as Australia and Japan and New Zealand and the US, so wealthy developed countries. And what they do is they take the life expectancy rates for all the member countries and create an average. So you then compare countries like the UK or the US and see how it stacks up against the OECD average or aggregate. And if you look at the US in the 1960s, it had the highest life expectancy of any of the OECD countries. But by 1998, it had fallen below the OECD average. And then every year since then, it has fallen further and further behind. And the reason I'm pointing this out is that while there's been talk about the last couple of years when life expectancy is actually reduced in the US, it's actually been a slow burning issue that's been going on for decades. But for now, let's just stick with the current situation. There's actually lots of similarities between the UK and the US in terms of why this is happening. But I want to first address the potentially biggest reason, which I didn't mention when speaking about the UK because it's not an issue over here, or at least not to the same degree. So the US is currently dealing with an opioid epidemic, and it's seeing more deaths because of this epidemic. And this is horrible for many reasons, but in terms of life expectancy, it has a huge impact because of the age of those who are dying. If you're 72 and you die, you've lived close to life expectancy. So this will have a minor impact on the average lifespan. But when more people are dying in their 20s and 30s and 40s, this is at an age that is vastly below life expectancy. And so this starts to then pull down the average much more dramatically. So for example, the Spanish flu of 1918 had a huge impact on life expectancy figures during that year because so many young people were affected. The Spanish flu was also the last time the US had 3 years in a row of declining life expectancy. And it looks like that this is what's going to happen. But this time it's in a large part because of the opioid epidemic. And interestingly, if you break the population figures down into different age groups, we can see this even more. So between 2015 and 2016, the life expectancy for someone who was already between 65 and 74, or already between 75 and 84, their life expectancy in the US actually increased. It was marginal, but it did increase. And this is because at this age range, people typically aren't getting into opioids. But for the categories of age between 15 all the way up to age 54, life expectancy is decreased. To put some numbers on this, there has been a 21% increase from 2015 to 2016 in drug overdoses, with the majority of these being in the 25 to 54 age range. And in actual figures, instead of percentages, it was more than 64,000 deaths in 2016 alone. That's more deaths than the US suffered in the whole of the Vietnam War. Overdose is now the leading cause of death for those under 50, and the number has tripled from what the figures were in 1999. But this is only telling half the story, because the crisis can cause health complications and death outside of overdosing. So, for example, there has been a steep rise in many infectious diseases. So hepatitis C is up by 300%. Hepatitis B has increased in some areas. There are increases in endocarditis, septic arthritis, epidural abscess, osteomyelitis, HPV and HIV, all linked to opiates. So when people are dying from these diseases or complications connected to these diseases, opiates are still at the heart of it. So this is a huge problem. It's not the only reason for the change in life expectancy figures in the US, but it's probably the single thing that has had the biggest impact. And we can dig into this even further, because there was a great editorial in the BMJ that was published earlier this year looking at the falling life expectancy rates. And they talked about the deaths of despair, because not only is there an opioid crisis, deaths from alcohol abuse and from suicide are also up. And they point out that over the last 3 decades, which is the time in which the US has fallen further and further behind the OECD aggregate, there's been a number of changes that have occurred. So to quote the article, over the 3 decades in which survival advances slowed in the US, educational performance weakened, social divides including income inequality widened, middle class income stagnated, and poverty rates exceeded those of most rich countries. The US is rich, but its wealth is not inclusive. Its social contract is weaker than other countries. Those in need have less access to social services, healthcare, or the prevention and treatment of mental illness and addiction. The American dream is increasingly out of reach as social mobility declines and fewer children face a better future than their parents. End quote. So what we're seeing here is something similar to what has been happening in more recent times in the UK. That inequality, more than anything else, is having an impact on life expectancy in the US. And there's been a couple of great articles about this on Vox. And one of them alerted me to some research done by some economists at Stanford University. So they found that from 2001 to 2014, the richest Americans gained about 5 years of longevity, while life expectancy for the poor didn't budge. They also broke down life expectancy figures state by state, and they compared the poorest 25%, the second 25%, the third 25%, and the richest 25%. And the gap between the lowest and highest is between 7 and 10 years in every state. Now, what this research found, which is the same as in the UK, is that life expectancy is correlated with health behaviours. So smoking, high alcohol consumption, lack of exercise, a poor diet do make a negative impact. But to think that it's a simple matter of a choice and that wealthy people just want to be healthier and that poor people just don't care really isn't the case. And some of this isn't just down to economic reasons. This is learned behaviors. It's social norms based on what the people who are around you do. And this was something that came out of this work from the Stanford researchers. So to quote the Vox article about this, the strongest pattern in the data was the role geography played. Low-income individuals lived the longest and had more healthy behaviors in cities like New York and San Francisco, with populations that are on average well educated and high income. In those places, poor people seemed to behave more like wealthier folks. They smoked less, exercised more, and were less obese. End quote. When talking about the UK, I mentioned about the role of diabetes and Alzheimer's and its impact on life expectancy figures. And this is true in the US to even more a degree. But again, this is linked to inequality. And one of the biggest things to come out of the recent elections, both with the Brexit vote and the 2016 US presidential elections, is how there is this forgotten group of people in areas that have seen a collapse of industries and local economies that they supported. And as I said earlier, this isn't about politics. It doesn't matter who or what you voted for. But what the life expectancy figures show more than anything else is that inequality and economic disparity are the biggest reasons for the changes in life expectancy in the UK and the US. Dietary and lifestyle habits matter a great deal, but to think we simply need to tell more people about the paleo diet to solve the problem shows a disconnect from reality. More information works best when people have the means and the capabilities. But even then, it's not that successful if it's not addressing the why behind someone's behavior. I really do hope that you can tell that this is an issue that I'm passionate about. I see too many people in the health sphere who live in some delusional world thinking that if people went organic or ate more greens, that things would be very different. But before I turn this into some long rant, I'm just going to leave it there. So that is it for this week's podcast. As I mentioned, I am working on another episode that looks at the complexity of health and why we are mistaken if we think that it's some easy fix. So you can think of this as a prologue to that episode, albeit quite a long prologue. Again, I want to mention that I'm taking on clients at the moment. If you're interested in working together or finding out more, you can head over to www.7, so the word all spelled out, seven-health.com/help, so HELP. And there you can read about how I work with clients and apply for a free initial chat. So that is it for this week's show. I'm actually going to be away next week, and I've unfortunately run out of time to put together a show. So next week there will be a rebroadcast episode, but I should be back soon with another new episode. Look after yourself in the meantime.
Thanks for listening